Good day, I am Casey of BSN3 and today I am going to perform nasogastric tube insertion. Nasogastric tube, it is passed through the nose and into the stomach. This type of tube permits the patient to receive nutrition through a tube feeding using the stomach as a natural reserve of food. In addition, this also decompress or drain unwanted fluid and air from the stomach. For example is when promoting healing after bowel surgery. It will allow the intestinal tract to rest. Lastly is used to monitor bleeding in the gastrointestinal tract to remove undesirable wastes such as lavas, poisons, and to help intestinal obstruction. Let us now proceed to the assessment of the procedure. First is we should assess the patency of the patient's snare by asking the patient to occlude one nostril and breathe normally through the other. Select the nostril through which air passes more easily. Good afternoon, ma'am. I am your nurse for today and you are for the nasogastric tube insertion procedure. Ma'am, can I ask you to occlude one nostril? Occlusion of nostril will know if there is an obstruction on passing of air on this occlusion. The right nostril is the part where air passes easily. Next is assess the patient's history for any reason, facial trauma, polyps, blockage, or surgeries. Patient's medical history has no facial trauma, polyps, blockage, or surgeries. The rationale for doing this is patients with facial fractures or facial surgeries present a higher risk for misplacement of the tube into the brain. Many institutions require a physician or advanced professional to place nasogastric tubes in these patients. Lastly, for the assessment is, of course, we need to inspect the abdomen for distension and tenderness. If the abdomen is distended, consider measuring abdominal girth at the umbilicus to establish a baseline. Auscultate for bowel sounds and peristalsis and palpate the abdomen for distension and tenderness. This is to check if there is an abdominal abnormalities such as masses, pain, fluid accumulation that are contraindicated on the NGT insertion. Ma'am, I am going to inspect your stomach before the nasogastric tube insertion procedure. As I palpate the abdomen, it is soft, no distension, no pain, and no masses palpated. Okay. After the assessment, let us now proceed with the implementation. First is verify doctor's order. This is to ensure that we provide the appropriate care and service for the client. Ms. Jimenez for nasogastric tube insertion. Next is perform hand hygiene. This is to prevent the gross contamination between the patient and a healthcare provider. After that is identify the patient. This is to verify if we are handling the right patient. Hi ma'am, good afternoon. I am Lisa Nikdao, your attending nurse for today. And you are? What's your birthday? Next is explain the procedure to the patient and explain the rationale why the tube is needed. Discuss the associated discomforts that may be experienced and possible interventions that may this discomfort. Answer any question as needed. Ma'am, I am going to perform nasogastric tube insertion, which means I am going to insert a tube through your nostrils and to your stomach. This is served as a way to receive the nutrition needed by your body. Since food intake through your mouth is not applicable, do you have any questions? Okay, ma'am. Of course, gather all the equipments needed appropriate for the nasogastric tube insertion. Rationale for doing this is to have them readily accessible during the procedure. Loose the patient's beside curtain or door. Raise bed to a comfortable working position, usually elbow height of the caregiver. Assist the patient to high Fowler's position or elevate the bed 45 degrees if the patient is unable to maintain the upright position. Drape chest with bath towel or disposable pad. Have emesis basin and tissues hand. Next is measure the distance to insert tube by placing tip of tube at patient's nostril and extending to tip of earlobe, and then to tip of xiphoid process. Then, mark tube with an indelible marker. Next is lubricate tube tip at least 2 to 4 inches with water-soluble lubricant. After that is apply topical anesthetic to nostril and oropharynx as appropriate. Gently insert the tube into the nostril while directing the tube upward and backward along the floor of the nose. Patient may gulp when tube reaches the pharynx. Provide tissues for tearing or watering of eyes. Offer comfort and reassurance for the patient. When pharynx is reached, instruct the patient to touch chin to chest, encourage the patient to sip water through a straw or swallow even if no fluids are permitted. Advance tube in downward and backward directions when patient swallows. Stop when patients breathe. If gagging and coughing persist, stop advancing the tube and check placement of tube with tongue, plate, and flashlight. If tube is curled, straighten it and attempt to advance it again. Keep advancing the tube until pen marking is reached. Do not use force, rotate tube if it needs resistance. Ma'am, would you touch your chin to chest and sip a water then swallow? Discontinue the procedure and remove tube if there are signs of distress such as gasping, coughing, cyanosis, and inability to speak. After that is secure the tube loosely to the nose or cheek until it is determined that the tube is in the patient's stomach. First is attach syringe to end of tube and aspirate a small amount of stomach contents. Measure the pH of aspirated fluid using pH paper or a meter. Place a drop of gastric secretions onto pH paper or place a mount in plastic cup and dip that pH paper into it. Within 30 seconds, compare the color of the paper with the chart supplied by the manufacturer, and then visualize aspirated contents, checking for color and consistency. Aspirated contents is color tan. pH level is 0.40, which means the tube is placed on the stomach. Secure tube with commercially preferred device or tape to patient's nose. To secure with tape, cut a 4-inch piece of tape and split bottom 2 inches or use package nose tape for NG tubes. Place and split end over bridge of patient's nose and then wrap split ends under tubing and up and over onto the nose. Be careful not to pull tube too tightly against nose. Measure length of exposed tube. Reinforce marking on tube at nostril with indelible ink. Ask the patient to turn the head to the side opposite the nostril in which the tube is inserted. Secure tube to patient's gum by using rubber band or tape and safety pin. For additional support, tube can be taped on patient's cheek using a tip of paper. Ma'am, would you turn your head to the other side of your nostril in which tube is inserted? Next is assist or provide oral hygiene at 2 to 4 hours interval. Lubricate the lips generously and clean nares and lubricate as needed. Offer analgesic throat lozenges or anesthetic spray for throat irritation if needed. Ma'am, we are already done with the procedure. And I am going to lubricate your lips as well as to clean your nares. And this is also the analgesic anesthetic spray for your throat irritation, and use this 2 to 4 hours interval. Remove equipment and return patient to position of comfort. Remove gloves and raise head and lower belt. After the procedure, perform again hand hygiene. This is to prevent the spread of microorganisms from being contaminated. Now, we are already done with the assessment, planning, and implementation. Let us now proceed for the evaluation. Evaluation of the patient is: patient exhibits a nasogastric tube placed into the stomach without any of complications. And then, patient demonstrates weight gain indicating improved nutrition. Next is Patient remains free of any signs and symptoms of aspiration. Patient rates pain as decreased from before insertion. Patient verbalized an understanding of the reason for nasogastric tube insertion. We are done with the evaluation, and now let us proceed for the documentation. February 12, 2022, patient was undergone on a nasogastric tube insertion. French 12 nasogastric tube size was used. Measurement of insertion from the tip up to the end of exposed tube is 51 cm. No X-ray was taken. Gastric contents color is tan. pH content is 4.0. This established acidity. This means that nasogastric tube is placed on the stomach properly. Next is tube is placed on the right nares and the patient doesn't experience cyanosis, gasping, coughing, and inability to speak. For the data, subjective data, I don't feel any pain on my stomach. This is verbalized by the patient. And for the objective data, abdomen was no sign of distension. It is soft and firm. Bowel sounds 5 to 30 per minute, which means it is normal. And for the health teaching, patient received oral care 2 to 4 hours interval. Lubrication for lips is also given, and anesthetic spray for throat irritation. That's all. Thank you.